Hello everyone, and today we'll be just talking about tuberculosis. So we'll be finishing it in few minutes, and it is completely based on your MCQ exam. These notes are made so that you can tackle most of the MCQ exams questions. So let's start. So firstly, we'll be just talking about tuberculosis. Tuberculosis, of course, an entire video we'll be just talking about tuberculosis. So tuberculosis is also known as Kochs disease. You need to remember one thing, that tuberculosis can be the major symptoms of HIV. Okay, this is like very asked question. Anyway, communicable disease. This is communicable disease, and it mainly kills more young women than other infectious disease. Causative agent of tuberculosis is Mycobacterium tuberculosis, or it is also known as tubercle bacilli. And tuberculosis is disease of poverty. Tuberculosis bacteria form tuber cells. Okay, so basically it is formed at the favorable sites such as lungs. In some case, it releases toxin called tuberculin, and it causes tuberculosis. Okay, so here I have written Mycobacterium bovilis. It is basically a kind of similar to like Mycobacterium tuberculosis, but it causes abdominal tuberculosis, like and it is present in contaminated milk. Anyway, let's move forward. Mycobacterium tuberculosis, it is an acid fast bacilli, also infect cattle, and it is a rope shaped, discovered by Robert Koch. So here R and R is common, so it is basically discovered by Robert Koch, and it is rod shaped. Incubation period is very variable. In different books there are different types of incubation periods, so you can just take a book as a reference. That will be more beneficial for you. Anyway, let's talk about two types of tuberculosis. Basically, it's a pulmonary and extrapulmonary. Pulmonary is basically related to lungs, and extrapulmonary is basically apart from lungs, everywhere, other than lungs. Anyway, so let's talk about some symptoms of tuberculosis. Symptoms is persistent cough, chest pain, malaise in night, sweating, anexuria, these kind of symptoms. Blood seen in sputum due to hematitis. Hematitis is basically like presence of blood in sputum. So when is World Tuberculosis Day celebrated? This is on 24 March. Tuberculosis of spine is called Kochs disease. It is very important as well. Like, there are some questions from here in different types of exam. They are just asked. Okay. We're at the Kochs disease. So now let's talk about test of tuberculosis. Tuberculosis has some very unique tests. For example, sputum test, X-ray test, multiple puncture test, Mantoux test. These are some tests of tuberculosis. Now let's talk about control of tuberculosis. So control of tuberculosis, of course, if it's any kind of disease, we'll give some drug to them. So basically it has like two kinds of drug: bactericidal drugs and bacteriostatic drugs. So you can just say here bactericidal, it means to kill any, and we have bacteriostatic. Static means like uniform, so it's basically to inhibit the growth of the bacillus. Okay, so bactericidal drugs, we have here examples. You can just learn these, and bacteriostatic examples are here. Okay, so I will refer you to learn bacteriostatic drugs because it's more easy. It's just two: ethambutol and thioacetone, whereas pyrazinamide, rapamycin, iodozine, and streptomycin, these are like bactericidal drugs. So now let's talk about its like control measures. So it comes as dots: directly observe treatment short course. Like sometimes like we are asked like the full form in MCQ exam, so you just need to understand it's like directly observe treatment short course. And SSC means short term therapy, MDR means multi-drug regime. Anyway, BCG means it's kind of vaccine which is given to the tuberculosis patient. So its full form is Bacille Calmette Guerin. So these are like so confusing, and this can be asked in your exams, so you just need to keep it in your mind. So I think the most important portion from here was like kind of the like causative agent, TB, and the site of infection, pulmonary. What is pulmonary? Subpulmonary. Blood is seen in sputum is hematitis, and this bactericidal drugs is pyrazimide, rifampicin, and isoniazid, and streptomycin. Yeah, these are like kind of very important part. And bacteriostatic drugs that impair ethambutol and thiacetozone. So that's all was for today. I hope this video would help you a little bit, and thank you so much for watching till the end. We'll see you in the next video. Bye.